We're going to give it a couple more minutes. I guess I can get started. I'll tell you guys the story of Team CarePal before I jump into the demonstration. I'm looking for my Chief Product Officer. Oh, Genevieve. Oh, please introduce yourself. You are such a big partner for Team CarePal. I would love for you to, while we're waiting, just share a little bit
Sure.
about you and what you guys do and the important work you guys do for family caregivers of this province.
Sure. So I'm Genevieve Warren. I'm with Caregivers Alberta. I'm the services navigator, which means that I find the resources for all our clients. So Caregivers Alberta supports family and friend caregivers, the unpaid workforce. We support with coaching, resources, education, connections, all of that. Yeah. So that's what we do. And again, we are we will never cost our clients money. So yeah, we're here to help.
We love Caregivers Alberta. They use our platform currently,
Mhm.
sending information on their programs and resources right into the families that use our free app. And this allows, bridging that gap between, families needing support, and all of a sudden they get to subscribe their app to Genevieve, and she gets to support them along their journey. And it is just amazing. And we adore Caregivers Alberta. So thank you for all the work that you do, Genevieve.
No, and thank you for the work that you do because
Yeah.
like you guys are offering an amazing service and an amazing way to stay current, stay organized, stay with it in situations that are really hard to have the bandwidth to do it, you know?
Absolutely.
So yeah. No, it's great.
Yeah,
I'm
just
happy to be
I know
here.
we fit so well together.
Yes, yes, we do.
And that's the beautiful thing of Team CarePal is we get to partner with community, with health, with social support, and to bring caregivers through that journey together. And it's really quite a beautiful pathway, which I'll definitely share with you guys. Welcome. Yes, feel free to turn on your guys' camera. I love seeing smiling faces first thing in the morning. So my name is Cindy Sim, and I am the CEO of Team CarePal. What that means is we've created an app for families. The journey started very early, about we're 5 years old. And the journey started actually at the bedside of my loved ones during my caregiving journey. I had a daughter who was incredibly premature. At that time, I would have been a young caregiver, which brings its own challenges financially, and others. And I remember being very, very hungry. I didn't have a lot of money back then, and just navigating her survival. And she's beautiful. She's 24. She's lovely. And then my mother, and father, they live in rural Alberta. So, Rocky Mountain House, the men were always away in the oil patch. And, the women did a lot of the caring for our loved ones, including my mother, who had multiple surgeries and, managing small kids back then and looking after her. And then all of a sudden, I found myself at the end of life stages of all my grandparents. We have a very big Dutch family, and I cared for all of them, and held them. And there was burnout in every single one of these journeys. It was very hard. I found myself crying in parking lots between vehicles. It was very challenging. And, beside the bedside, I would always say to my beautiful husband, there's got to be an app. Like, can we help families? This is insane to me. This is so overwhelming. I wasn't recognized. I wasn't, supported. And so, yeah, it started way back then in my mind that there had to be a better way, that we can leverage technology to connect families to supports. And then the onset of the pandemic came, and I had gone back to university for business at that stage, doing a pivot of my career from being an EA. And at the pandemic hit, and we realized very quickly, family caregivers were in a lot of the media, of having to manage the care of their person at home, not having access to healthcare services in a reasonable way. And so my husband said, "Honey, you got to do this app. Just start, because our parents are aging, and everybody just needs some help and some love." So we did, and we started it in university. And our first app developer was with the beautiful Paisley Churchill, who is on the call right now. She was our first product manager back then. And we developed the framework of an app of what we thought would be a really good app. Turns out we were completely wrong, which is not abnormal. You can laugh at that because it's so true. We went and we surveyed, 100, 150 family caregivers, just asking them, like, what were you using to manage the care of your loved one? And they gave us all kinds of amazing responses. And so we realized what we had in the app was not at all what families needed. So we went back to the drawing board. We completely gutted what we had started and we started fresh. And we allowed the voices of family caregivers to shape the app that it is today. In those stories, there was a lot of burnout in every single story. And it shocked me to the core that families were feeling this way, feeling forgotten, feeling overwhelmed. So we decided to make reducing burnout for family caregivers, our North Shining Star. We also saw that there was a lot of financial stress and burden put on our families in those conversations. And so we decided at that moment that we had to be a social enterprise and that the app will always remain free for families so that they can use it to stay connected and use it to get the resources and supports that they needed along the journey, hoping that we can reduce some of that burden, that they're carrying. And then, of course, we do a lot of advocacy in the province and across Canada to government and sit on many different committees. Paisley, I'd love for you to take a moment and share who you are and the work, your story.
Hi, I'm Paisley Churchill. I'm the Chief Product Officer at Team CarePal. As Cindy said, I was there right from the beginning on the app development side. I worked at Cindy's first app developer and we got to build out the mock-ups. And after about 6 months of working together, Cindy went away to go raise funds so that she could build the app. And when we came back, we decided to scrap it and we had so many different features. And then we really began that, version 2 and doing all that work together. And in between all of that, unfortunately, my grandmother was diagnosed with stage 4 cancer, and she was my second mom. I grew up with a single mom, so she was very close to me. And I went through a 7-month caregiving journey that was very intense, right until the end. And as soon as she had passed, and I ended up getting fired during that caregiving journey from the same app development company. It was just a lot to handle when you're working from hospice, when, there's family dynamics. I'm sure all of you understand exactly the mental state I was in, to also lose my job. And then a few weeks later, I reached out to Cindy and I said, I get it. I get what you're doing. I want to be a part of this. We need to change this for other people. And it's been 4 years almost since that happened. And it's just so amazing to see the response that we've gotten from caregivers, from care homes, from hospitals. There's just so much need in this space. And it's just been really an amazing journey and one of the most truly truly impactful things I've ever done in my career. So thank you all for being here. We are so excited to launch the new version of our platform soon. We have put our heart and soul into this, and it is finally HIPAA compliant. It is finally has every feature that you've been asking for a year. It's going to have French language support, additional language support. We're going to be able to get into more work with more people across Canada. We're really excited. So thank you all for being here.
And we, started after we built the app, everybody, we were talking to all of our friends and industry leaders, from long-term care, from hospitals, from churches, pastors wanting to connect to their homebound members, communities wanting to do better for their aging population and community. And they said, can you develop us a dashboard that can connect to the app where families can subscribe to us and we can set, support families and send that information through, exactly what Genevieve does. And so we launched a beta and we gave them our app that we had launched and we said, develop it for us. What do you want? And so they co-designed our dashboard for us. And, this is really important to understand, is that Team CarePal doesn't do anything without the voices of families at the core of what we do. And that's what makes us incredibly different than those other one-to-one products on the market today, is that we walk alongside families in their journey and build it around that journey. And so we developed this dashboard, and it's purely unique and beautiful. And like I said, we started in senior care homes. I'll show you some videos, of their, experience with Team CarePal, but it was really beautiful because these amazing senior care homes, Canterbury Foundation, Golden Healthcare, gave us their families and their staff and said, take it, learn from our families exactly what communication they want and at what levels of care. And then, we worked with the staff in these senior care homes, understanding where that information was coming from and how we could develop that flow. We worked within the hospitals, Glenrose Hospital, understanding the discharge challenges of families and the gaps, the insane gaps of them going into communities, which led us, going into communities, into rural Alberta, which you'll see we have some FCS teams on here that we're working with. And understanding the challenges in rural Alberta communities and, their aging population and how those communities can better support seniors and families through, mobilizing community and wrapping around them with support with volunteers. So we're going to take you on a journey. I'm going to share my screen. Start with our beautiful land acknowledgement. I am joining from Edmonton, Alberta, which is located on Treaty 6 territory. And so we acknowledge our presence on the lands of Indigenous peoples across Alberta. We are committed to ongoing dialogue and shared learning to support all family care partners to care and to maintain their health and well-being. The roles and responsibilities of family caregivers are celebrated by Indigenous people for the purpose that the role gives to the care partner's life and for the value of caregiving to the individual and to the community as a whole. I carry our Indigenous communities so close to my heart, and the work that I've gotten to do in Saskatchewan, working with Golden Healthcare and our homes in northern Saskatoon. We learned very quickly that there's a huge Indigenous population in that area, and we knew we had to open these homes to them. And so we started collaborating with the Saskatchewan Tribal Council, and I had the honor of wearing a ribbon skirt and going to ceremony and building those relationships. And now our beautiful homes in that area actually do culture days, and they do sewing, activities, ribbon skirt making, and they've really done a beautiful job of working with Indigenous in their communities to work together and partner together and support their families. We always want to keep this front and center. So who are the care partners and why do they matter? And I feel like you guys are on here because you already know anyone supporting a friend or family member with care is considered a care partner or a caregiver, depending on how you identify them. This can include different things from simple grocery runs and errands to appointment scheduling, transportation, medication management, and a huge one is that navigation, advocacy, and decision support. And why do they matter? Well, you guys, they hold up our healthcare system. Let's be honest. They provide up to 90% of care in our communities. They even provide up to 30% of care in our beautiful facilities. And there is 8 million across Canada right now, even more so. Many of our families are finding themselves in that sandwich generation where they're caring for children yet, and they have aging parents. The reality of this is that they're experiencing burnout. Like I said, I went through burnout, Paisley went through burnout. Everyone we talk to has some level of burnout. And the reality of this is that they end up trying to do it alone. And this is where things really start to affect. It affects their mental and physical health. A lot of family care partners will end up leaving work temporarily, go down part-time, or even leave the workforce altogether. This ends up impacting them financially. We've done health economic modeling on caregiver burnout. And when they reach, that 20 hours of care or more per week, women, our beautiful women, coronary heart disease starts to double. So when you're talking about reducing, as pressure on our healthcare system and supporting families to age in place in community, we need to include family care partners. We really need to start paying attention and start looking at them as a huge part of our healthcare system. So today I'm going to start my journey through this demo as a care partner. And I am in rural Alberta where my Nana is aging and living alone. My papa passed away a few years ago, and without realizing it, most of the care starts to land on me and my family. This is dear to me because my parents and my in-laws and all my family mostly are in rural Alberta Rocky Mountain House. And I guarantee you they are not leaving the acreage that they are on. So this is very home to me. And I am facing this as many Albertans are. So when a loved one is managing all the care and it starts to land on them, things start happening. We'll take you into Nana's community that I've started
Oh,
with
wow.
my family. But, it's not just logistics, worry, it's the emotional weight, it's the distance, it's the driving to and from appointments, it's keeping caregivers up at night. And so for me personally, I needed one place where my family could stay aligned and support could show up around us. Caregivers don't have time to go looking for help. A lot of time they don't identify themselves as caregivers, so they're not out there looking for Caregivers Alberta because they don't even know they're a caregiver. What they need is for support to be wrapped around them and carry them through the journey. So this is where Team CarePal is different. The journey doesn't start in a hospital where it typically does when family caregivers are faced in that crisis mode. It should start in community, and it can. In this town, in my beautiful rural town where my Nana is, I see Team CarePal posters up in everyday places, the library, the post office, community boards. And when I asked my local FCSS team about it, they said, download Team CarePal. It is a place where volunteers can help seniors in our communities, but it's also a safe place for you to come together and care for your loved one. So this really matters because when support comes from people you already trust in your community, it feels safe and it feels normal. So of course I download the app and I invited all my family and friends onto Team CarePal, allowing us to share wonderful photos. Yes, that's my beautiful tuxedo cat, but it's a place where families can come together near and far and share and support one another, whether they're a neighbor, whether there's someone from your church organization or, family that lives far away. So the families really do need a starting point. So inside this private family community, I can stay organized. I can create appointments on my calendar. I can integrate them with my phone calendar onto my phone, which is really, really important. I was able to build out task lists. This is really huge. We co-designed this one with Family Caregivers of BC because, they had this beautiful program getting caregivers to map out all the things they could ask for help. But they found there's this massive barriers of family caregivers were unable to pick up the phone and start calling and try to find help because it was just another thing added on to their already full plates. And so by enabling family caregivers to build out task lists and ask their friends and families exactly what they need. So in this case, Nana's coming home. We need to install grab bars. We need this help with. And this allows the family to come in and instantly help with whatever that person is needing, which is really beautiful. One of the things I love about Team CarePal is the fact that they have assessments in here. So I was able to, as a care partner looking after my Nana, start looking at these burnout assessments. I was able to take them weekly and stay on top of tracking my burnout. Again, this is really important because when family caregivers hit burnout, it's not only their physical and mental health that starts to suffer, it's their relationships with their loved ones. They start isolating from friends and families. They stop sleeping. And so these are things that end up now our caregivers get sick. Their loved ones will end up in our hospital system or in, early senior care homes where they don't necessarily need to be. So we really need to be paying attention. And so we track caregivers burnout and enable them to understand what it is that they're going through. And the beautiful part about it all is that we are able to send support right to them using Zolo. Zolo is our AI bot, and it's not that scary. She's trained on an internal database. Team CarePal does a lot of work with the University of Alberta Caregiver-Centered Care Team, Dr. Sharon Anderson, Jasneet Parmer, researchers in Saskatchewan, Australia. So they've helped to kind of co-design Zolo and her training and how she should act and be culturally, respected and safe. She is only trained on an internal database that we share with our beautiful partners like Caregivers Alberta. They share resources with us, we share with them. And so we really make sure that the things she's sharing are credible. And the beautiful part is that Zolo knows where I live. in the app. She knows what Nana's condition is. She knows my burnout levels. And so she can come in and respond to that based on what I'm going through. She'll come through and be like, okay, I see that your sleeping has changed, or that you're carrying a little bit more this week than you did last week. Did you know about Caregivers Alberta? I noticed, she knows I live in Alberta. So right away, she's going to connect me with Caregivers Alberta. And this is really important because, again, caregivers don't know what's available. They don't know what to ask. They don't know what they don't know. And so by walking these families through what they're going through, whether it's Alzheimer's, cancer, doesn't matter where they are, we can match them with the supports that they need when they need it. And you can talk to Zolo and she'll understand exactly what you're going through. So it gets that instant support. The other really great thing about Team CarePal living, my Nana being in this rural community, is that I'm able to come in and look at all of the organizations that have a dashboard. This allows me to subscribe to these organizations and get that instant support. So I was just happened to be, in Nana's community, and FCSS Zolo was the one that set me up with the app. Well, I noticed that they also had this code, and it was a volunteer hub, which means that I was able to put that code in and join their volunteer hub. So in a click of the button, I get to switch from my private family community into my rural Alberta volunteer hub that my FCS team has set up. And this allows me to come on. I get to read exactly how the program goes, how to ask for help. I get to see all the beautiful ways that these volunteers in these rural areas are helping seniors just like my Nana. And because I live in Edmonton and my Nana lives hours away, it is incredibly stressful for me not to be able to be by her side all the time. And I know she's isolated since my papa passed away. And so I just want someone to check in on her and visit her, maybe water the flowers with her because she loves her garden. And so in here, I was able to message Rose, one of the admin. I was able to look at the task list and see exactly what was available in their community for support. And the moment I was able to message their administrator and ask if someone could come in and check in on my Nana, they were able to do that. They set up that task. We had volunteers. It was on my calendar, lickety split. This is such an incredible thing that rural Alberta communities can come together. I want to touch on this because we do have some of our FCS teams on here. When they came to us, and I want to say this was co-designed by our rural Alberta communities, 4 FCS teams, 3 counties side by side, just Edmonton all the way to Wainwright. And they said, Cindy, we want to develop this inside Team CarePal. And my heart just like rumbled. I was like, absolutely, you can have anything you want. And so we got to co-design this with them. But the beautiful part about these rural communities is it wasn't just the FCS teams, it was their foundations. It's, when we launch this next month, it's their municipalities coming together, their library, their schools, everybody is coming to the table to launch this volunteer program and work together to better understand how they can support their beautiful seniors and family care partners in these communities. Through all these collaborations, that we can really develop that integrated care model all the way starting in community. And so a year from now, we will have developed a beautiful playbook on exactly how to launch these volunteer communities all across Canada and into USA. So going back to Nana, now that I have a little bit of capacity in my life because my family now has a place to stay organized, we're getting support from Zolo. Zolo mentioned Caregivers Alberta, and so I'm going to dive into the support. I noticed Caregivers Alberta is on here, and so what that means is I can subscribe to Caregivers Alberta. The cool part about that is all of a sudden I get all their resources and supports directly into my app in an instant. And the cool part is now Genevieve gets a cute little notification on her end that I have joined her dashboard. So she knows all about me and she gets to start sending some really cool information into the app on their programs. And the cool part about this, especially when we were in, Glenrose Hospital, is a lot of families are so overwhelmed when they hit that crisis stage that they get all these pamphlets and brochures, and they have no idea. And I always ask them, did you know about Caregivers Alberta? And they say, oh, I heard about them, but I don't know what they do. And so I said, download the app, subscribe to Genevieve. She's going to tell you. And so Genevieve gets to just send, little bits of programs. And so while I'm caring for my person, I get to see the beautiful programs that Genevieve is sharing. And when I have capacity, I know that I can jump into a peer-to-peer support group because Genevieve has shared that with me. I don't have to go looking anymore. It comes right into my app, which is really beautiful. So now, as all things happen, Nana's doing very well, but there comes a moment that many families know too well. So her mobility has been declining. And so one night she gets up to go to the bathroom, she feels dizzy and she falls in the dark, fracturing her hip. This is the point where families fall into chaos. Who's at the hospital? Who's calling the siblings? What's the plan? What do we bring? How long is this going to be? What do we need to be organized with? So with Team CarePal, thankfully, we're able to keep everything in one place, all the way into the journal. Family, the caregivers specifically in this group are the ones that get to see the journal. And then you have other users that don't necessarily get to see the journal, depending how families set up the app. But this is a beautiful way for families to come through and stay on top of, Nana's discharge and things like that. So again, Zolo's in there. She's helping us coordinate because now we're trying to figure out what to do. Nana's going to need different things when she comes home. She broke her hip. How do we manage? One of the beautiful things in our launch is that we have a care partner needs assessment going into the app. Again, co-designed by University of Alberta's Caregiver-Centered Care Team, amazing researchers, and Glenrose Rehabilitation Hospital, Patient and Family Advisory Council. They have all been an active part in this, diving into that discharge process and the needs that family caregivers needs before their discharge. When we started the journey, I asked these families and their loved ones, how did you feel? Where are the gaps? What did you wish was different? And they used words like dumped, forgotten, left. How they described the discharge process was heartbreaking, and they were very unprepared going home. And so through this experience and through their lived experience, we've developed a caregiver needs assessment. And this will allow families to take it and understand, are they prepared? Are they educated on what they need to do when they go home? And where are the gaps in the social services? We assume families go home and they're just going to bring their loved one to the follow-up appointment. But is that the case? Have we even asked them if they have transportation capabilities? Where are those gaps in services? And then, of course, if they're already burnt out at that stage, we're in big trouble and this family's going to need more support. So again, Zolo, beautiful Zolo, will be trained on this caregiver needs assessment and will be able to fill in those gaps. Now, unfortunately, Nana ends up in Glenrose Rehabilitation Hospital. And, no matter how much you care for your loved one, she cannot come home. She needs 24/7 care. And this is heartbreaking for families. This is usually where they hit the wall because, they don't know what to do. I mean, right now with our senior care homes filling up, where do you go? What are the needs in these homes? Who cares for what? What does this look like? Nobody knows what to do in this situation. Thankfully, Team CarePal has a list of trusted navigators that they have listed in here. So if you go to resources, we have all of our navigators here in Alberta, all the way from Caregivers Alberta, Coach, they can reach out to Genevieve, to Nana's navigators, you name it, they're in here. You can reach out to them. And these navigators will help navigate that system for you and help find you a place that works for you and your family and your loved one. In this case, my navigator helped guide me to a Zolo Senior Living and Care Home. Because it happens to be in Edmonton, it was close by, I can visit them. It had all levels of care. My navigator went in and checked it all out, and it checks all our boxes. So I was able to request access to them. I knew that they were caregiver-centered care certified and that they used the app. The important thing of this, and especially when your loved one is going into senior care, is you want to be updated. You want to be a part of that care plan, especially if you're living far away and you don't get to visit that often. It is really heavy on families trying to figure out how their loved one is doing in care, wondering what their wellness is like. So if you connect with a senior care home that is using Team CarePal, you know right away that they care, that this organization is going to bring you in and keep you completely updated. We've done a lot of work in our senior care homes. So I, request access, and I'm going to jump over to our dashboard. And the cool part about the dashboard is that not only do they get to set their families up with the app, but they also can have people subscribe to them. So right away, I can see that Cindy is joining us, Nana Sim, we've already talked to them. Yes, we're moving Nana in, and we are so excited to have her. Now, what this means is as a senior care home, I get to send updates to this family specifically on how their loved one is doing. The cool part about what we get to do very, very soon in the coming weeks is integrate with EMRs. So we're going to be integrating with Point Click Care right away. And this allows in the senior care home, we can sync our family lists in our dashboard to that EMR. And the beautiful part is in the journal, the personal directive who's been identified in the app will get a specific journal section that is only for them, and they will get view only access into the EMR where they can then receive things like cognitive updates, changes on activities of daily living, some really specified pieces of information, just so that they can stay on top of Nana's care and understand what that aging journey is like. In senior care, families are scared. They don't understand the aging journey, and it could look like things are going smooth, and then one day it stops and there's a big drop in how that loved one is doing. And things happen like falls. And when things happen, a senior care home has a choice. They can either, avoid families, and then that causes major conflict when things happen. Or if you're like the senior care homes that we work with, they partner with families in care, meaning they walk alongside them so that when things happen, they work together, the relationship is built, and they're very passionate and they continue forward. And it is the most beautiful relationship way to look after someone in senior care. So right away, I have their care contact list. This was something across the board that families said to us in senior care homes, is they have no idea who to contact in senior care home when issues arise, like food or housekeeping. The other cool thing that our senior care homes are doing in task lists is they're setting up task lists for things that Nana needs in care. So one of the complaints we received was families would show up to visit their loved one, and then they would realize that, oh my goodness, Nana needs all these things. She needs toothpaste, she needs more shampoo. So then they would have to leave their visiting time to go and get these things and come back. And they were really disgruntled about this. So allowing housekeeping to come in and fill those, or the unit clerics, so that families are prepared when they come to visit. The other really cool thing that we're going to be showing is being able to book an appointment right onto that senior care home's calendar. This was, again, a huge time wasted activity. Families would call, they would email. There was all these different methods of communication going into our senior care homes, and the front desk and the unit clerks were scrambling, trying to figure out where everything was. And then when they were trying to book the meeting, they would have to call back, and then the family was working. And so there was this constant back and forth, where now we will be seamlessly allowing families to book the time that they need to go and pick Nana up, take her to the dentist, or maybe take her out for a coffee very, very quickly. And it's going to be seamless. So this is another really exciting piece for our senior care homes. I do want to take a moment to share with you a video.
Whereas through Team CarePal, if we connect them personally, there is that different level and approach of they actually care. They're actually reaching out. This is personal, and there is an approach, an appropriate one, but also a connected one.
The good thing is our residents, we're now telling them, like the family that Calais signed up today, I'm so excited because their mom is just so special. But now we can say, okay, what do you want to tell your, today's your update day. What do you want to tell your parent? And so today I may have had to shed a little tear or two, because I was like, we need to get this family on Team CarePal, because their mom had just such an amazing morning today, and we haven't had amazing mornings for quite some time. And today I was like, that we are sending those pictures to the family. And so here we are.
It's all in one spot. Prior to Team CarePal, I had like so many different things. That I do communications, I do socials, I do, and to have kind of our own community with our own kind of page with all the memos, all the photos, and then individualized page with photos and updates, like it changes the game. That's kind of like this constant tool that just integrates in as and lessens the amount of like things we're using, because I had like 17 different ones. And so I love the work that you folks are doing to report on residents' activities. It means so much to blank and myself, since we're so long away from Edmonton. Thanks. And so like I have so many of those, and just, it means something to families just to be able to get that quick update.
And they actually had 3 families this week pop in just to tell them how amazing it is. And then and one of them, I was in there and I'm like grabbing my paperwork and I'm like listening with my big ears, right? And the family's like talking about the updates and how they just love it. And it was funny because now it's like, oh, we're seeing the positive reaction and positive effect.
We did the legwork to educate the right people. And now our trial is like, it's going to be permanent, right? Like, and after Diamond House, the goal is to get every home in our Golden Healthcare network online, right? And the reason is because when we look back and we talk about that feeling and that connection, connectedness, we spend a lot of time managing emotions. The residents' emotions, the family's emotions, our own emotions, like how we're feeling. And this is meeting that need in a lot of ways.
So in our dashboard, it's really quite beautiful because it can be used in so many ways. Like I said, from Genevieve using it to walk alongside families with their programs and supports, to our senior care homes being able to send updates. And we've developed a beautiful, change management guide and best practices, knowing exactly what families are wanting and how, so we can walk alongside our senior care homes and really bridge that gap with families and communication. There's all these amazing ways that you can send information out, from, posting events to into their journals. You can chat one-on-one with families. You can set up your own customized resources, and of course, being able to survey in your communities. You can manage them through labels, and you can send information out based on, your label group. So it's really quite beautiful. I'm going to jump into our partnerships and kind of what's next. So Team CarePal has been very, very busy, and I don't know if Paul Sharman is on the call or not. He was going to try and be here. So new features, yes, multi-language support. And I see Lorena Foster is here from Alberta Innovates. She has been a huge support to Team CarePal, and so has Alberta Innovates. In fact, last year, Alberta Innovates gave Team CarePal $300,000. Wave, Lorena! To elevate our platform clinical level compliance. And that is what we are launching. And what that means is that it allows us to be top level security. And like when Paisley said, we're HIPAA compliance in USA, PIPEDA compliant in Canada. In Alberta, we're a little extra than the rest of the provinces. So we will have privacy impact assessment addendums and our privacy impact completely all done and ready to go. Our platform is compliant in the UK and Europe for future growth. And what this means is that the user's data actually gets to be stored in an incredibly secure way in the country that they're from, which is really important to our families. We are also going to be launching multi-language support. So French is going to be added very, very soon. What this means is that it opens up an incredible amount of partnerships going Eastern to Canada. We will have EMR integration, appointment bookings is coming soon. And then of course, with a lot of the work we do in different rural areas, some of those senior care homes don't have access to EMRs. And so they requested that we, provide a nurse role, which will still be able to identify the personal directive and still be able to send those updates in a very secure way, really bridging that gap for those, senior care homes that don't have an EMR that they're using. So we were able to really customize the platform for everyone's needs and check all their boxes. Now, the partnerships that we have been working on, which we're really excited about, Team CarePal is a part of PACE Canada. They are the program of all-inclusive care for the elderly. What that means is their whole main focus is keeping Canadians healthy and happy at home. And one of the beautiful things about PACE Canada is we're building PACE sites across the country. There is PACE Canada USA, which we're going to be working with. I'm traveling down there next month. But one of our PACE sites, as an example, in Burlington, Ontario, is a 26-story senior care home, or not senior care home, apartment. And in this apartment is all aging adults. And so what we're going to do in the bottom 2 levels that are commercial space, we're going to go into that apartment complex. We're going to understand all of the needs of the residents living there. And then we're going to learn the needs of those family caregivers. And we're going to set up everything those people need to age in that apartment building and not have to enter the healthcare system. We're going to provide wraparound supports for them. And so that's what PACE does. PACE has access to all the technology partners that we need to do this. One of these technology partners is Constant Caregiver. And I'm not sure if Chris Ebert is on the call, but we are integrating to Constant Caregiver. And what that means is this will allow us to support families and caregivers in community and in senior care homes by leveraging technology like wearables, ambient sensors, radar, and those types of things. And the beautiful part about this is that it really allows us to understand exactly what that senior care person needs, from learning their patterns to understanding how many times they're going to the bathroom, how they slept the night before. Sleep is so important that if a loved one doesn't sleep very well, they're at risk of falls that day. So we want to understand, if they're going to the bathroom, do they have a UTI? Because that's a different pattern. When a senior care ends up with a UTI, a lot of times they'll be put into delirium state, and then they get miscoded in our healthcare system. And we don't want that. We don't want them in our healthcare system. We want them thriving at home. So stay tuned for all these incredible partnerships, because we're going to be sharing them and we'll invite you guys to them. Constant Caregiver, right away, both of our homes were like, oh my gosh, sign me up. Let's do this. Like, it was just no hesitation for them at all. And so we get to be doing really cool things across Canada, working in communities, to how can we connect starting in communities and how we can support those families. Does anyone have any questions? I feel like that was a lot. And Shelley, it is so good to see your face. Yes, any questions? Tony.
We have a quiet bunch this morning.
We do. Yesterday was a bunch of chitter chatters.
It's morning, that's why.
I don't know. I don't know if it's actually that we're all like super quiet. You guys did a really good job of explaining it.
Okay, thank you.
Yeah, no, as someone who also presents new things, and you guys did a really good job. Kudos.
Like the journey works, like, because I was like, I wanted the journey of the family. I could share tech, I could go into all the boring details of how to set up a survey, but no one wants to hear that. We want to hear how this is going to impact, families and make a difference for them. So thank you, Genevieve. You're so lovely.
Yeah, thank you.
All right.
I have to say, Cindy, I'm really excited for the fact that it's going to be secured out the wazoo because a lot of the places that I work with home care teams. I am a home care team for a bunch of patients with dementia and stuff like that. And some of the families were very, very kind of like, I love the idea, and seeing some of the things that you're bringing in and the partnerships that you're bringing in is just going to be so awesome. I can't wait to use it on our new platform.
Yes, and I have you on my list. Crow's Nest Past. I'm going to turn that entire area into a Team CarePal community with you, and we're going to do incredible things, Shelley. I'm so excited. Thank you.
From Okotoks down, we're going to have this.
100%. Yes.
And I think that's I think that's a great thing to touch on too. We've heard from a few people, well, why are you charging this? Why are your prices the way they are? And I think a lot of people don't realize how much work and effort and maintenance goes into a fully HIPAA compliant system. So there's something called SOC 2 compliance that's very expensive to get certified in. Our developers have to have that. They have to pretty much build out 2 to 3 lines of code for every line of code in our whole platform, because it needs to actually be encrypted at rest and in transit, which is different than most apps. Other things that are different about a fully compliant system is that everything touches the database. So when you're building any other type of app, they might not know that you visited this page on this day. Those aren't things that you would typically track. That's a lot of work to build out those database tables. That's a lot of work for every single time you go to a new page to actually write something to the database that says your name, the time, the actions. All of that is data that we have to store as a fully compliant system to make sure that we have audit logs showing that nobody accessed sensitive information. So I think there's a lot of things that people don't really realize when you're building a system like this. We had to do UI changes. We had to force timeouts. You have to do more two-factor authentication. You can't just have it, like your Facebook that would just stay logged in forever. This needs to log you out in case you walk away and your sensitive information is out. There's so many little things that took UI, that took consultation with experts, and that will take ongoing maintenance, ongoing penetration testing, ongoing additional security on our actual platform. So I just wanted to share a little bit about that because I think it's something that people don't really realize. And our prices have changed to reflect our new security, but we're still a social enterprise. And I think it's really important for people to realize how many apps out there are not certified, are not following any sort of standards to this kind of stuff, and it's a little bit scary. And when you see prices that are super low, $30 a month, for a communication app, just know that's not what we have here. It is so safe. It is going to stand up to all the different standards, and we're really proud of that and having built that with our partners.
That's a great point, Paisley, because as I'm working and as I'm advocating in some of these smaller rural communities, everything is done on email now, and people don't realize, like, even Alberta Healthcare Services and stuff like that, they won't send you things over email because of that security and because of the way they have to do those processes. And so when I get into these small communities that are like struggling and creating home care services, they don't realize that there needs to be that extra level in a lot of cases. And so just showing them that you want to be able to be protective of your loved ones and the people that they're caring for is a huge eye-opener for them.
Yeah, Michael Bankowski. Well, robotics. Talk about robotics. Michael is next up as a partner with us. His company is doing incredible things for robotics and building robotic walkers that will adjust as per your physical therapy. They're looking at building physical therapy, robots that you can place in rural areas that don't have access to it. And so he does incredible work. And yes, Michael, we are launching this as soon as we launch in US, we'll be going to Rochester, New York, where we have a senior care home, a beautiful senior care home, and Care Patrol team, and a senior society in community, all ready to go to build that community as a Team CarePal community. So we have a lot of work lined up down there, and places in Florida and Arizona as well, where there's a huge aging population. It's interesting in those areas that families have actually paid for home care aides to go into senior care homes to get updates. And so this is happening. And so these senior care homes are very, very excited to be able to bridge that gap of communication and provide that to families. Oh, thank you for coming, Tracy. We love you so much, honey. She's another FCSS team we're going to be launching with. You guys, thank you so much for joining. Is there any other questions?
Yeah, there is a couple
Tracy.
questions. Yeah,
Hi,
Theodore.
thank you. Yeah,
Yes,
wonderful presentation. I'm a social worker in healthcare, so I'm really excited to hear about this. And my apologies, I was running a little bit late. And so at the beginning, I thought I heard you say that as a social enterprise, this app didn't cost for families. Is that correct? Or is it families that pay the membership fee? Or is it Okay,
The
thank you.
app is completely free, Casey. So please share it as a resource. That was one of the things we, had to do, realizing that families were under financial strain.
Awesome.
And one of the beautiful things that we do is we actually sell the dashboard to our organizations like senior care homes and stuff. And that's where we make the revenue to carry the platform. The other beautiful thing that we were able to do, and this took months of strategy and industry leaders, is that we were able to sort of blend the cost across healthcare and community and allow even a discount to our nonprofit users because the caregiver might be attached to two dashboards. And we don't want to double dip. We wanted to make sure that the cost is low enough for everyone to be included along this journey. But yes, share the app. It is 100% free.
That's awesome to hear. Okay, so yeah, just to make sure I understand that cost that Paisley was describing earlier is actually covered by the care homes, the nonprofits, grants, that kind of thing. So the public and the private sector. Am I hearing that correctly?
Yes, it's mostly by senior care homes who are using this as a way to communicate with their members. And so that's who carries the cost, because they have the financial incentive to ensure that families are, in the loop, and it actually helps them to create better outcomes. So that's how we position it to them, and they're seeing a lot of success. So and there are other platforms out there that do family communication. However, what we're doing that's really different than anyone else is it's not a one-to-one relationship. And so we've actually had so many people reach out asking us if we would white label our platform and they could buy it. And we've said no to that revenue because it's really important for us to bring both the caregivers and the care homes into one caregiving ecosystem where they can actually follow multiple organizations along their journey. We don't want to be another family communication platform where a home buys it, you get your app, and then as soon as you leave the home, you're out of that ecosystem. Caregiving doesn't end when you leave that home, when you switch. Caregiving, is a very long process, and that's really, really important to us and what sets us apart.
Brilliant. Thank you so much. This is super exciting.
Thank you.
It was also really, really nice to hear the collaboration that you have done with communities, rural communities, Caregivers Alberta, and so really great to hear that this was developed from, the ground up with communities, with those with lived experience. Yeah, thank you so much.
Thank you, Casey. And I can't wait to chat with you further.
And we have one more question from Theodore.
Okay, thank you for this incredible app that you've developed. Here in Nigeria, I think this is going to be a game changer in the care industry here, especially making it global. I think with this introduction, I'm going to push it into care homes here in Nigeria, especially here in Africa, in such a way that when we test run it here in our system, you could get a different perspective of what Africans think about care homes and caregiving. And then you are going to update it based on our African perspective and then ideologies in terms of caregiving. I think this is a very welcome development. Thank you for reaching out to us, and then I'm happy to be part of this launching team. Thank you.
Thank you, Theodore. Theodore and I met a few weeks ago, and the state of family caregivers across the globe doesn't just end in Alberta or Canada or USA. In Africa as well, they're facing these exact same challenges in their healthcare system, being siloed and family caregivers having to hold it all together. And so when Theodore saw what Team CarePal was doing, he was like, I have to be a part of this. We have to launch this in our communities. So thank you for joining, Theodore, and for all your support. We look forward to supporting your communities as well.
Thank you.
Awesome. Well, if there's no other questions, I will end this call. I will send out the recording for you guys to share and for anyone who might have missed it. And I just really want to say thank you guys for all the amazing support and passion that you guys live and breathe each and every day. Team CarePal, at the end of the day, yes, we are, providing a product, but it's still just technology. Families need connection. They need Caregivers Alberta. They need Allison and Kim to walk alongside them and, fill in those gaps. You still need that human connection. Team CarePal just gets to elevate it and make the impact a little bit more and bring those connections together. So it is not without you guys that we can do what we do. So thank you. And have a beautiful day, guys.
Thank you, everyone.
Thank you so much.
Thank you.
Thank you.